We're joined by Dr. Robert Duncan. He's an infectious disease specialist at Lahey Hospital and Medical Center. Thanks for being with us.
Thank you.
So phase one of this reopening, it started today. Places of worship, hair salons, barbershops, beaches, they'll start opening over the next few weeks. Should people be concerned about going to any of those places, even with this reopening? What is the level of risk?
I think we're in support of these reopening plans. I think it allows a return toward normal while maintaining some caution. And I think that there's always risk of infection while COVID is around, but I think there are a lot of things that we can do to make that risk small and to reduce concerns. I would say, first of all, people should be cleaning their hands, wearing a mask when out in public, keeping distance from other people, maintaining physical distance of about 6 feet or so, and avoiding people who are sick and staying home if you're sick. So you don't want to go to work if you're sick.
All good points. All right, so we know each phase of the reopening could span about 3 weeks before we move on to the next one. So if we were to experience a resurgence of cases, how soon would it take us to see that?
Well, what we've learned from things like Mardi Gras and some other events is that the usual time to infection occurs about 2 to 3 weeks afterwards. Okay. People develop the infection and it shows up in about that time frame. At some of the funerals in the South and the Midwest, people were getting together closely, hugging, sharing food together. And most of those cases occur sometimes as soon as 2 days later, but usually in the 2 to 3 week range.
Okay, so these are things to watch then as we go into these next couple weeks. We also know that some elective procedures can begin again at hospitals. Tell us about what's happening at Lahey. What can patients expect to see? How will things be different when visitors really have been kept away for weeks now?
Yeah, we're trying to readapt now. I think people can expect to, when they come in the front door, to be asked about any symptoms they might be having. They'll be asked to wear a mask when they come in. We're trying to keep visitors down to a dull roar so that we minimize the risk of having somebody come in who's infected. And there will be spacing so that chairs and waiting rooms are kept separate from each other as much as possible.
Yeah, it's going to look a lot different.
Don't be surprised if somebody's wearing a face shield over their mask. That provides an extra layer of protection.
Okay, all good insight. Dr. Robert Duncan, thank you so much for being with us tonight. We appreciate it.
You're welcome.